About gabapentin brand name, Neurontin. Gabapentin is used to treat epilepsy. It's also taken for nerve pain, which can be caused by different conditions, including diabetes and shingles. Nerve pain can also happen after an injury. In epilepsy, it's thought that gabapentin stops seizures by reducing the abnormal electrical activity in the brain. With nerve pain, it's thought to block pain by affecting the pain messages traveling through the brain and down the spine. Gabapentin is available on prescription. It comes as tablets, capsules, and a liquid that you swallow. Key facts: you'll usually take gabapentin 3 times a day. You can take it with or without food. Most people who take gabapentin do not get any side effects. But some people may feel sleepy, tired, and dizzy. Common side effects are usually mild and go away by themselves. It takes at least a few weeks for gabapentin to work. Most people do not have to stay on the same brand of gabapentin, as there's very little difference between brands. Some people can become addicted to gabapentin. When stopping gabapentin, you'll need to reduce your dose gradually to avoid withdrawal symptoms. If you have epilepsy, you are entitled to free prescriptions for all the medicines you take, not just your epilepsy ones. You can get an application form from your doctor's surgery. Who can take gabapentin? Gabapentin can be taken by most adults and children aged 6 and over. Who may not be able to take gabapentin? Gabapentin is not suitable for some people. To make sure it's safe for you, tell your doctor if you have ever had an allergic reaction to gabapentin or any other medicine, have ever misused or been addicted to a medicine, are trying to get pregnant or are already pregnant, are on a controlled sodium or potassium diet, or your kidneys do not work well. Gabapentin liquid contains sodium and potassium, so speak to your doctor before taking it. How and when to take gabapentin? Gabapentin is a prescription medicine. It's important to take it as advised by your doctor. Dosage and strength: each capsule of gabapentin contains 100 mg, 300 mg, or 400 mg of gabapentin. Each tablet contains 600 mg or 800 mg of gabapentin. If you're taking gabapentin as a liquid, 2 ml is usually the same as taking a 100 mg tablet or capsule. Always check the label. Dosage for epilepsy: the usual dose for adults and older children aged 12 and over is 900 mg to 3,600 mg a day, split into 3 doses. Younger children aged 6 to 12 varies depending on their weight. Dosage for nerve pain: the usual dose to treat nerve pain in adults is 900 mg to 3,600 mg a day, split into 3 doses. Changes to your dose to prevent side effects: your doctor will prescribe a low dose to start with and then increase it over a few days. Once you find a dose that suits you, it will usually stay the same. How to take it: swallow gabapentin capsules and tablets whole with a drink of water or juice. Do not chew them. You can take gabapentin with or without food, but it's best to do the same each day. Try to space your doses evenly through the day. For example, you could take it first thing in the morning, early afternoon, and at bedtime. If you or your child are taking a liquid, it will come with a plastic syringe or spoon to measure your dose. If you do not have a syringe or spoon, ask your pharmacist for one. Do not use a kitchen spoon, as it will not measure the right amount. How long to take it for? If you have epilepsy, it's likely that once your condition is under control, you'll still need to take gabapentin for many years. If you have nerve pain, once your pain has gone, you'll continue to take gabapentin for several months or longer to stop it coming back. If you forget to take it, if you forget a dose, take it as soon as you remember. If it's within 2 hours of the next dose, it's better to leave out the missed dose and take your next dose as normal. Never take 2 doses at the same time. Never take an extra dose to make up for a forgotten one. If you have epilepsy, it's important to take this medicine regularly. Missing doses may trigger a seizure. If you forget doses often, it may help to set an alarm to remind you. You could also ask your pharmacist for advice on other ways to help you remember to take your medicine. Stopping gabapentin: it's important not to stop taking gabapentin suddenly, even if you feel fine. Stopping gabapentin suddenly can cause serious problems. If you have epilepsy, stopping gabapentin suddenly can cause seizures that will not stop. If you're taking it for any reason and stop suddenly, you may have a severe withdrawal syndrome. This can have unpleasant symptoms, including anxiety, difficulty sleeping, feeling sick, pain, sweating. It's possible to prevent withdrawal seizures and other symptoms by gradually reducing the dose of gabapentin. Do not stop taking gabapentin without talking to your doctor. You'll need to reduce your dose gradually. Common side effects: like all medicines, gabapentin can cause side effects, although not everyone gets them. These common side effects of gabapentin may happen in more than 1 in 100 people. They're usually mild and go away by themselves. There are things you can do to help cope with them: feeling sleepy, tired or dizzy, feeling sick, nausea, being sick, vomiting, diarrhea, mood changes, swollen arms and legs, blurred vision, dry mouth, difficulty getting an erection, weight gain, memory problems, headaches, getting more infections than usual. Keep taking the medicine, But talk to your doctor if this advice does not help and the side effects bother you or do not go away. Serious side effects. Very few people taking gabapentin have serious problems. Call a doctor or call 111 straight away if you have a serious side effect, including thoughts of harming or killing yourself. A small number of people taking gabapentin have had suicidal thoughts, which can happen after only a week of treatment. A high temperature, swollen glands that do not go away, your eyes or skin turn yellow. This may be less obvious on brown or black skin, unusual bruises or bleeding, severe tiredness or weakness, unexpected muscle pain or weakness, with or without a rash. These may be symptoms of a serious reaction. Long-lasting stomach pain, feeling sick or being sick. These may be warning signs of an inflamed pancreas. Muscle pain or weakness and you're having dialysis treatment because of kidney failure. Seeing things that are not there. Hallucinations. Serious allergic reaction. In rare cases, it's possible to have a serious allergic reaction. Anaphylaxis to gabapentin. Long-term side effects. Some people can become addicted to gabapentin. If this happens, you'll have withdrawal symptoms after you stop taking the medicine. When you stop taking gabapentin, you'll need to reduce your dose gradually to avoid withdrawal symptoms. Do not stop taking gabapentin without talking to your doctor. Talk to your doctor if you're concerned about becoming physically dependent on gabapentin. Gabapentin and pregnancy. Gabapentin is not generally recommended in pregnancy as there is not enough information about whether it's safe for your baby. However, from the small amount of information that is available, there's no clear evidence that it's harmful. It should only be taken if the benefits of the medicine outweigh the risks. If you take gabapentin for epilepsy, it's important that this is well treated during pregnancy, as seizures can harm you and your baby. Keep taking gabapentin, but talk to your doctor urgently. They may recommend you change to a different medicine. Gabapentin and breastfeeding. If your doctor or health visitor says your baby is healthy, you can take gabapentin while breastfeeding. It's important to keep taking gabapentin to keep you well. Gabapentin passes into breast milk in small amounts. It has not been known to cause any side effects in breastfed babies. If your baby is not feeding as well as usual, seems unusually sleepy, has a stomach upset, or if you have any other concerns about your baby, talk to your doctor, pharmacist, health visitor or midwife. Gabapentin and fertility. There's no evidence to suggest that taking gabapentin reduces fertility in either men or women. However, discuss your pregnancy plans with a doctor. They may wish to review your medicine and prescribe a higher dose of folic acid for you to take 5 mg a day before you become pregnant. Speak to a pharmacist or your doctor before taking gabapentin if you're trying to get pregnant. Cautions with other medicines. Some medicines may affect how gabapentin works or increase the chance of you having side effects. Antacids can reduce the amount of gabapentin that the body takes in, so it does not work as well. To stop this happening, if you need to take an antacid, take it at least 2 hours before or after your dose of gabapentin. Tell your doctor if you're taking any of these medicines before you start gabapentin treatment. Strong painkillers, such as morphine. These can make you very tired and dizzy when you start taking gabapentin. Antidepressants, such as amitriptyline or fluoxetine. Antipsychotic medicines for mental health problems like schizophrenia or bipolar disorder. A medicine to prevent malaria called mefloquine. Mixing gabapentin with herbal remedies or supplements. Taking herbal remedies and supplements that can make you feel dizzy or drowsy while you're taking gabapentin could make these side effects worse.